Hey there.
Sorry, I had my headphones on. I mean, off.
Oh, good. Celia's at a feeding therapy appointment right now, so I'm FaceTiming the doctor's appointment.
Oh, wow. Fun.
Yeah, so inopportune timing.
Yeah, I'm arguing with the DoorDash guy who got mad at me because apparently I listed my address wrong, but re- listed it correctly. So I'm gonna have to go get my food from upstairs momentarily.
Lovely. All right, I'm working on.
Yep,
All
that
right.
looks good.
Okay, hold on. Let me get it situated so I can see so I can see my notes, but also see the chat and such.
Oh, I don't know how to do that.
Okay, I think I got it. Cool. So you can see.
I see just what I'm supposed to see, just the presentation.
Beautiful. Okay, awesome. Thank you for confirming.
You have it as March 2022 there. I
Okay,
mean,
I'll change
it
that real
doesn't
quick.
matter, but that's funny. Okay.
Okay, thank you.
Thank you.
Hello, everyone. This is Marissa Whitehouse. We'll get started in about 3 minutes. Thank you for being here today. Hi, everyone. We'll get started in about a minute. Thank you for being here. All right. Thank you, everybody, for being here this afternoon. We can go ahead and get started as it's 3 o'clock. I will be letting people in as they arrive. So forgive me if we have just a couple brief delays as we get started and people continue to come into the call. Can everybody see my first slide okay? You can give a thumbs up, you can unmute and put into the chat.
Yes.
Great. Thank you very much. All right. I see, is that a question or just a yes? Happy to answer a question before we get started if it is indeed a question. Okay, we'll assume that that is just a yes. So thank you to the guest who raised their hand for that. I'll go ahead and lower that hand. There we go. Okay, and with that, I will go ahead and get started with today's discussion. All right, so this call will discuss the details of the SMP Senior Medicare Patrol State Project Grant opportunity for the state of Vermont. This is the informational call to make sure that we go through the details of the notice of funding opportunity and answer any questions that have arisen related to that. I am Marissa Whitehouse. I am the Senior Medicare Patrol.
Yeah, I just joined. So
I am the Senior Medicare Patrol Program Manager at the Administration for Community Living. As you log in, I think everybody is now muted, but please make sure that you remain muted throughout this call. We will have time at the end, hopefully, for questions and answers. And if not, we will be preparing an FAQ that will be posted on ACL's website that includes answers to all of the questions that we didn't have time to get to. This call is being recorded and the recording will also be posted on that site. So with that, I'll go ahead and get started. As a reminder, I'll be your primary contact for this funding opportunity. As you have questions, you can save them till the end or you can enter them into the chat. I'm the only presenter today, so I likely will not be seeing any questions that you enter until there's a break a little bit later, but I will make sure that we try to get to those. So with that, today we will be covering the different sections of the funding opportunity, including those that you see on your screen. As a reminder, if you do have questions, we hope that the vast majority of them are already answered within the NOFO narrative. So please review that, be sure that you have reviewed that document in full. We will not go through every detail of the NOFO today. NOFO is Notice of Funding Opportunity, as a reminder. So it is extremely important that you read the full document yourself, in addition to participating in today's call and submitting any questions that aren't addressed in either. A timeline of all related deadlines is shown on this screen, with the most important deadline being the due date of applications, which is April 15th of this year, 2024. Please note that applications that fail to meet the application due date will not be reviewed and will receive no further consideration. You are strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Do not wait until the last day in the event you encounter technical difficulties, either on your end or with grants.gov. Grants.gov can take up to 48 hours to notify you of a successful submission. So please keep that in mind, and every funding opportunity we have potential applicants who struggle on that last day to submit. So we encourage you to give yourself plenty of time. Program overview. The SMP mission is to empower and assist Medicare beneficiaries to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. To further this mission, all SMP program activities are organized around 4 strategic program objectives, which we will go over now. In just a second. This funding will run from June 1st, 2024 through May 31st, 2028. That's 4 years worth of funding, with an estimated total funding per year of $330,000 per budget period. The expected number of awards is 1, meaning that ACL plans to fund 1 new SMP project. The award floor is $1,500 per budget period, and the award ceiling is $400,000 per budget period. As I said, the length of the project period is 48 months, and that includes 4 12-month budget periods. This award will be made contingent upon the availability of federal funds. ACL will rerun the funding formula annually once the total funding availability for the SMP project grant has been established for the fiscal year. ACL will notify the Vermont SMP grantee and all other SMP grantees of the state funding amounts as soon as possible each year, at which time ACL will request annual budgets from applicants and grantees. From grantees. Grantees will be able to adjust their budgets accordingly on an annual basis. The provided total funding amount was derived using the funding formula outlined in the NOFO and applicants are only eligible for the funding amount associated with their state. We at ACL also encourage you to apply for the full amount listed. All right, strategic program objectives. This opportunity will fund the SMP work done in the state of Vermont only. Applicants must address, one moment, letting someone else in. Please be sure that you're muted. Thank you so much. All right, this opportunity will fund SMP work done in the state of Vermont only. Applicants must address each of the following strategic program objectives as part of their project narrative to further the goals of preventing Medicare fraud in the state of Vermont. First one is to provide group education and one-on-one assistance to Medicare beneficiaries on a statewide basis with a specific emphasis on those with greatest need. Applicants must plan to recruit, train, and retain a diverse, sufficient, effective, and representative workforce equipped to provide high-quality education and one-on-one support. They should plan to monitor and assess SMP results through operational and quality measures. And they should plan to position the SMP to nimbly and effectively respond to changes in the programmatic landscape. Project narratives should propose specific goals and activities to address each component of the 4 strategic program objectives, which I will outline further in the coming slides. Please be sure that you've reviewed the full information in the NOFO, as again, I will only go over the highlights, and additional crucial information is included in the full document. All right, so strategic program objective number 1 is to provide group outreach and one-on-one assistance to Medicare beneficiaries on a statewide basis with a specific emphasis on Vermonters with greatest need. Applicants must describe a comprehensive plan to achieve statewide SMP coverage. Statewide coverage means the applicant must have the capacity to provide SMP services within the state, including group education and one-on-one assistance in each county within the state of Vermont. In the project narrative, applicants must demonstrate knowledge of the geographic service area, including barriers to program access and strategies specifically designed to overcome these barriers. They must identify populations with greatest historical and current need within the state, any barriers to program access specific to these populations, and plans for addressing these barriers. They should explain plans to provide one-on-one assistance, both in person and virtually. Applicants must describe the types and levels of service to be provided, as well as the approaches to achieve or enhance services, such as the development of websites and web-based strategies, the use of toll-free lines, ability to flexibly shift to atypical service provision as public need requires, and/or the development of subgrants, contracts, or partnerships with other local, regional, or statewide organizations. They should explain plans to provide in-person group education sessions to teach beneficiaries to prevent, detect, and report Medicare fraud, errors, and abuse. Applicants must describe the types and levels of service to be provided, as well as the approaches to achieve or enhance services, such as the development of subgrants, contracts, or partnerships with other local, regional, or statewide organizations. They should describe plans to build on existing partnerships and the development of new partnerships to establish a strong network to deliver SMP services. And they should outline a statewide media and outreach plan based on a preliminary assessment of state and national healthcare fraud trends and issues, including focus on targeting those in greatest need of SMP program services and other traditionally underserved populations. Strategic Program Objective 2, to recruit, train, and retain a diverse, sufficient, effective, and representative workforce equipped to provide high-quality education and one-on-one support. Applicants must provide a plan to ready a nimble workforce to provide high-quality service to beneficiaries, including but not limited to the following. They should describe a plan to initially and continually train and certify all SMP team members. That includes staff, in-kind, and volunteers with the information necessary to perform the work of the SMP program. That includes work at both the most basic level and a more advanced level of workforce. Details on that are included in the NOFO. They should describe a plan to recruit, retain, and manage paid, volunteer, and in-kind team members throughout the state. The plan should include implementation of ACL's volunteer risk and program management policies, otherwise known thus far as VRPM, as well as ACL's conflict of interest guidance for the SHIP SMP and MIPA programs. Identifying and appropriately managing risks related to team members' involvement and service delivery is a very important aspect of effective program management. Proposals should include approaches to ensure team members are appropriately recruited and screened to ensure ability to perform assigned duties and to identify potential conflicts of interest, that they are thoroughly trained to provide effective service and enhance the quality of the SMP program, that they are consistently provided ongoing supervision, management, and support to ensure the safety, integrity, and professionalism of the SMP workforce, that they are habitually compliant with procedures and practices to ensure that confidentiality and the confidentiality of program information is maintained, and they should be supported to ensure retention and continued high morale. In every case, applicants should propose activities that will effectively employ the unique skills, varied experiences, goodwill, and availability of team members in assisting beneficiaries to become more educated about Medicare fraud, errors, and abuse. Again, please be sure you are familiar with ACL's VRPM policy and procedures, as well as ACL's conflict of interest materials, both of which are posted on ACL's website. The links are also included in the Notice of Funding Opportunity, or NOFO. Strategic Program Objective 3, monitor and assess SMP results through operational and quality measures. ACL measures SMP projects to use the SMP, ACL requires SMP projects to use the SMP Information and Reporting System, otherwise known as SIRS, to collect, track, assess, and measure program performance data. SIRS data is summarized annually in an HHS OIG report titled Performance Data for the Senior Medicare Patrol Projects. Recent reports are available on ACL's website. The applicants must describe plans to comply with SMP reporting requirements, including timely data entry of SMP activities into SIRS, including one-on-one interactions with beneficiaries, group education and outreach events, media education and outreach events, SMP team members, and SMP team member activities. It should include participation in quality assurance activities. And applicants should be sure to review and understand SMP's performance measures. Those are also listed in the NOFO. These are the basis for how the SMP program's progress is tracked by the department as well as by Congress. SMP Strategic Program Objective 4. Position SMP to nimbly and effectively respond to changes in the programmatic landscape. Applicants must propose a plan to adapt to changes in the programmatic landscape, such as the increasing Medicare beneficiary population, changes in geographic distribution of beneficiaries, changes in public health need, varied beneficiary needs by age, and traditionally underserved populations that may need additional assistance understanding how to prevent, detect, and report Medicare fraud, errors, and abuse. Specifically, applicants must identify any anticipated changes in the programmatic landscape and explain how these changes will be addressed by the SMP project, address readiness to nimbly and effectively shift as unanticipated changes in the programmatic landscape are identified, describe the target populations to be served, including identifying the target populations and the reasons why the applicant has chosen to target those specific populations, addressing barriers in access or provision of program services to the target populations, and detailing proposed innovation and collaborative methods to reach the target populations. Now we'll go into some of ACL's responsibilities. ACL will be substantially involved in the proposed project activities. ACL project officers and/or OHIC, which is Office of Healthcare Information and Counseling, team and leadership will execute the responsibilities of the cooperative agreement as listed in the NOFO. These include performing the day-to-day federal responsibilities of managing this grant initiative and working with the grantee to ensure that the necessary requirements for the grant are met, assisting the grantee project leadership and understanding the policy concerns and/or priorities of ACL, working cooperatively with the grantee to clarify the programmatic and budgetary issues to be addressed by the project, providing technical assistance to the grantees related to the fulfillment of the goals and objectives of this grant, reviewing and providing technical advice on grantee work products, providing consultation to the grantee in identifying emerging issues as they relate to the goals and objectives of this grant program, working with the grantee on the development and implementation of evaluation and quality assurance systems to ensure that performance is measured and continual improvement occurs, attending and participating in major project events as appropriate, and acting as representatives for the national SMP program. Grantee responsibilities. The grantee will execute the responsibilities of the cooperative agreement as included in the NOFO. These include participating in ACL education and communication activities, sharing information with ACL, fellow SMP projects, and other national, state, and local partner organizations, participating in training opportunities, which does include the annual OHIC conference. All new SMP directors are required to attend the new director orientation and training provided by ACL and the SMP National Resource Center as soon as possible following appointment. This includes attendance at any in-person or virtual training required for new directors by ACL. All SMP team members are required to meet minimum, initial, and ongoing training requirements, knowledge testing, and certification standards as clearly defined by ACL and state grantees. Grantees must adhere to the conflict of interest requirements and VRPM requirements referenced in the NOFO and mentioned previously. And grantees are expected to use grant funds to send appropriate staff to other pertinent trainings provided by ACL, CMS, or other federal state partners to ensure staff maintain a comprehensive understanding of grant expectations, Medicare knowledge to appropriately manage the grant, and potential fraud trends. Grantees are expected to maintain a customer-oriented and user-friendly toll-free telephone number for use by Medicare-eligible individuals for SMP-related inquiries. They should maintain a dedicated, up-to-date, publicly available webpage and online presence, and they should respond timely to all public requests, whether received directly or referred through national contact means and routed to their assigned state. Grantees are also expected to collect and input project performance data into the SMP data system in a timely manner in accordance with ACL's guidelines and training. Grantees are expected to coordinate with ACL and other federal partners to handle all outstanding Sorry, let somebody in and lost my place. One moment. Partners to handle all outstanding SMP related cases in a timely manner. They're expected to establish and or nurture ongoing relationships with SHIP and MIPA directors within the state to ensure continued communication about program overlap and opportunities to partner. They're expected to follow processes required by ACL and CMS regarding the use and management of 1-800 Medicare unique IDs. They are expected to include the express acknowledgement on all SMP related or funded public information materials, including those developed or disseminated by funding recipients. They are expected to use the national SMP logo and tagline on all SMP publications and products in accordance with up-to-date program branding requirements. And they are expected to never represent SMP nationally without detailed discussion and express prior approval by ACL. So who is eligible for this award? Please be sure that you meet the applicant eligibility requirements for this opportunity. Eligible applicants include domestic, public, or private nonprofit entities, including state governments, county governments, city or township governments, special district governments, public and state-controlled institutions of higher learning, Native American tribal governments, which are federally recognized, Native American tribal organizations other than federally recognized tribal governments, nonprofits having a 501c3 status with the IRS, other than institutions of higher education, nonprofits without 501c3 status with the IRS, other than institutions of higher education, and private institutions of higher education. This is a free and open competition. This opportunity will fund SMP work done in the state of Vermont only. Applicants may be physically located inside or outside the state of Vermont. There is no cost sharing or matching expectation or requirement to this award. Applicants that do not meet the responsiveness criteria will be administratively eliminated and will not be reviewed. A successful SMP applicant will be an organization that meets the following basic evaluation criteria. Demonstrated expertise in implementation through collaboration and work with volunteers to achieve program objectives. Technological capacity to implement the SMP web-based data collection data collection, management tracking, and reporting system known as SIRS, and organizational capacity to provide statewide virtual and in-person SMP program coverage. For an application to be reviewed, it must meet screening requirements included in the NOFO. Though the NOFO includes information about how to handle the situation if your application is unable to be submitted by the deadline, we do not plan to accept any applications after the deadline. Please start with plenty of time to submit a thorough application. Application and submission. Application materials can be obtained through grants.gov or acl.gov/grants/applying-grants. Please note that ACL requires applications for all announcements to be submitted electronically through grants.gov in Workspace. Grants.gov Workspace is the standard way for organizations and individuals to apply for federal grants in grants.gov. The grants.gov registration process can take several days. If your organization is not currently registered, please begin this process immediately. There is information on how to receive assistance from grants.gov within the NOFO. At the grants.gov website, you will find information about submitting an application electronically through the site, including the hours of operation. Again, ACL strongly recommends that you do not wait until the application due date to begin the application process. All applicants must have a UEI and must be registered with the System for Award Management, which is called SAM, and maintain an active SAM registration until the application process is complete. And should a grant be made throughout the life of the award. Go to the NOFO to learn more about SAM. In addition, all first-tier sub-award recipients must have a UEI number at the time of the sub-award. Read through this section of the NOFO very thoroughly to ensure you've done everything you need to do in order to be able to submit your application. We know you will have worked so hard at that point on the application, and we do not want you to hit a barrier that we are not able to support you in correcting. Due dates for letters of intent. Letters of intent, we request them by the end of the week this week. That's 3/8/2024. Letters of intent are not required, but they are encouraged and requested. The purpose of the letter of intent is to allow our staff to estimate the number of independent reviewers needed and to avoid potential conflicts of interest in that review. Letters of intent can be sent to me via the email address that is shown here on the screen. That's to Marissa Whitehouse within the Office of Healthcare Information and Counseling at marissa.whitehouse@acl.hhs.gov. All right, now we're going to go through the project narrative. The project narrative must be double-spaced, sized 8.5 by 11 inches with 1-inch margins on both sides, and a standard font size of not less than 11, preferably Times New Roman or Arial, should be used. Smaller font sizes to fill in the standard forms and sample formats can be used. The suggested length for the project narrative is 10 to 20 pages, with 20 pages being the maximum allowed. Project narratives that exceed 20 pages will have the additional pages removed, and only the first 20 pages of the project narrative will be provided to the merit reviewers for funding consideration. You can see the different sections of the project narrative here, and it is the most important part of the application since it will be used as the primary basis to determine whether or not the project meets the minimum requirements for grants under the authorizing statutes. The project narrative should provide a clear and concise description of the proposed SMP project. ACL recommends that the project narrative include the following components as part of the 20-page limit. You can see the different sections on your screen here. I won't go through them, but we will go through them on the next couple of slides for a little additional information. First is the summary abstract. This section should include a brief, meaning no more than 265 words maximum, description of the proposed project, including goals, objectives, outcomes, and products to be developed. Detailed instructions can be found within the NOFO. Problem statement. Describe this section requires you to describe in both quantitative and qualitative terms the nature and scope of the particular problem or issue the proposed intervention is designed to address, including how the project will potentially affect older adults and/or people with disabilities, identified state-specific marginalized communities, their families and caregivers, and the healthcare system and social services systems. The goals and objectives section asks that you describe the project's goals and major objectives. Unless the project involves multiple complex interventions, ACL recommends proposing only one overall goal. The proposed project goals and objectives should be reflective of the priority activities discussed in the SMP strategic program objectives. Proposed intervention. In this section, provide a clear and concise description of the proposed intervention to address the problem described in the problem statement. Describe the rationale for using the particular intervention, including factors such as lessons learned for similar projects previously tested in the targeted communities or in other areas of the country. Factors in the larger environment that have created the, quote, right conditions for the intervention. Also note any anticipated major barriers and how the proposed intervention will address those barriers. Be sure to describe the role and makeup of any planned strategic partnerships in implementing the intervention, including other organizations, supporters, or consumer groups. This section also provides a detailed plan for the management and operation of the SMP project. This opportunity, again, will fund SMP work done in the state of Vermont only. Applicants must address each of the strategic program objectives as part of the project narrative to further the goal of preventing Medicare fraud in Vermont. Special target populations and organizations. In this section, describe plans to involve organizations in a meaningful way in the planning and implementation of the proposed project. This section should also describe whether the proposed intervention will target commonly underserved populations, and if so, how will they do so? Measurable outcomes. Clearly identify the measurable outcomes that will result from the project. Please note, ACL will not fund any project that does not include measurable outcomes. Please pay very careful to this section, and this slide and the next slide. This section should also describe how the project's findings might benefit the field at large. List measurable outcomes in the work plan grid under measurable outcomes, in addition to any discussion included in the narrative, along with a description of how the project might benefit the field at large. A measurable outcome is an observable end result that describes how a particular intervention benefits consumers. It demonstrates the functional status, mental well-being, knowledge, skill, attitude, awareness, or behavior. It can also describe a change in the degree to which consumers exercise choice over the types of services they receive, or whether they are satisfied with the way a service is delivered. The focus of this section is describing what outcomes will be produced by the project. Use the evaluation section noted below to describe how the outcomes will be measured and reported. Applications will be scored on the clarity and nature of proposed outcomes, not on the number of outcomes cited. As discussed in Section 1 under S&P Mission and Strategic Program Objectives, ACL utilizes the SIRS data system to collect data, track, and measure a number of program outcomes. ACL will use program data contained in the S&P data system to assess S&P project progress in reaching S&P strategic program objectives. Hence, applicants' plans should discuss expected outcomes and link these outcomes to the project priorities and activities provided in the proposed intervention section upon which the outcomes have been based. So what is an output versus an outcome? An output focuses on how much change is expected. An output is the physical result of your work, something that can be simply counted and is often tangible. Outputs are important, but do not meet the requirements of the NOFO on their own. Examples of outputs include things like number of meetings held, number of people served, number of brochures distributed, number of trainings your organization will provide with this funding. These do not measure any change in behavior or knowledge as a result of the grant's activities. So a few program-specific examples of outputs would be providing 20 S&P focused trainings during the project period, serving 200 Medicare beneficiaries, distributing 1,000 S&P brochures to organizations that serve communities at greatest risk of fraud, etc. An outcome records the changes that occur as the results of your program. Outcomes are the differences you've made as a result of the outputs. Examples of outcomes include an increase in a person's ability to prevent Medicare fraud, a decrease in beneficiaries' reported lack of knowledge about how to protect self from fraud, an increase in LGBTQ population groups' access to modified resources that increase community awareness and understanding of potential Medicare fraud. ACL's focus is on measurable outcomes. So of the above examples, please be sure that you're providing additional information to ensure that those are measurable. These are essential and must be phrased in accordance with the guidance. Project management. This section should clearly delineate the roles and responsibilities of project staff, consultants, and partner organizations, and how they will contribute to achieving the project's objectives and outcomes. It should specify the key staff with day-to-day responsibility for key tasks such as leadership of project, monitoring the project's ongoing progress, preparation of reports, and communications with other partners and ACL. It should also describe the approach that will be used to monitor and track progress on the project's tasks and objectives. Evaluation. In this section, applicants should describe the methods, techniques, and tools that will be used to 1. Determine whether or not the proposed intervention achieved its anticipated outcomes, and 2. Document the lessons learned, both positive and negative, from the project that will be useful in replicating the intervention if it proves successful. In addition, please describe a plan for evaluating the effectiveness of the proposed S&P project in achieving project outcomes. As discussed, ACL utilizes SIRS to collect data, track, assess, and measure program outcomes. In addition, ACL will use data to assess S&P project progress in reaching S&P strategic goals and objectives. Hence, applicant plans must discuss priorities, activities, and staff capacity to capture program performance data accurately and timely. Dissemination section. This section should describe the method that will be used to disseminate the project's results and findings in a timely manner and in easily understandable formats. Recipients could include parties interested in using the results of the project to inform practice, service delivery, program development, and/or policy making, especially those parties who would be interested in replicating the project. Dissemination examples should include sharing information with ACL, the National S&P Resource Center, fellow S&P projects, and other state, national, and local and local partner organizations. Organizational capacity. Each application should include an organizational capacity statement and vitae for key project personnel. The organizational capacity statement should describe how the applicant agency is organized, the nature and scope of its work, and or the capabilities it possesses. It should also include the organization's capability to sustain some or all project activities after federal financial assistance has ended. This description should cover capacity of the applicant agency, not included in the program narrative, such as any current or previous relevant experience and or the record of the project team in preparing cogent and useful reports, publications, and other products. If applicable, include an organizational chart showing the relationship of the project to the current organization. Please include short vitae, 1 to 2 pages, for key project staff only. Neither vitaes nor an organizational chart will count toward the narrative page limit. Also include information about any contractual organizations that will have a significant role in implementing project and achieving project goals. Additional application sections include the budget narrative justification, which can be provided using the format included in the document that was provided or linked within the NOFO. Applicants are encouraged to pay particular attention to this section of the document, which provides an example of the level of detail sought. The project work plan should reflect and be consistent with the project narrative and budget. It should include a statement of the project's overall goal, anticipated outcomes, key objectives, and the major tasks or action steps that will be pursued to achieve the goal and outcomes. For each major task or action step, the work plan should identify timeframes involved and the lead person responsible for completing the task. Letters of commitment. Please include confirmation of the commitments and key activities or work made by key collaborating organizations and agencies in this part of the application. Any organization that is specifically named to have a significant role in carrying out the project should be considered an essential collaborator. For applications submitted electronically via grants.gov, signed letters of commitment should be scanned and included as attachments. Applicants unable to scan the signed letters of commitment can email them to me, Marissa Whitehouse, at marissa.whitehouse@acl.hhs.gov. In your email, please be sure to include the funding opportunity number and your agency name in the subject line. The grants.gov registration process, as I've said multiple times, can take many days. If your organization is not currently registered, please begin this process immediately. All applicants, again, must have a UEI number and be registered within the System for Award Management, otherwise known as SAM, and maintain an active SAM registration until the application process is complete. Please note, once your SAM registration is active, allow 24 to 48 hours for the information to be available in grants.gov before you can submit an application through grants.gov. This action should allow you time to resolve any issues that may arise. Failure to comply with these requirements may result in your inability to submit your application or receive an award. Important dates. You'll see here the due date for the application. Applications that fail to meet the application due date will not be reviewed and will receive no further consideration. In addition, if you are submitting your application via grants.gov, you must, number 1, be designated by your organization as an authorized organizational representative, or AOR, and 2, register yourself with grants.gov as an AOR. Details on these steps are outlined at the following grants.gov webpage that's included in the NOFO. After you electronically submit your application, you will receive from grants.gov an automatic notification of receipt that contains a grants.gov tracking number. If you are experiencing issues or problems submitting an application through grants.gov, please contact the grants.gov support desk toll-free. If you're prevented from electronically submitting your application on the application deadline because of technical problems with the grants.gov system, please contact the person listed under "For further information, contact," which would be me, Marissa Whitehouse. Note, again, we will not consider any application for further review if you have failed to fully register to submit your application to grants.gov before the application deadline, or if the technical problem you experienced is unrelated to grants.gov system. Funding restrictions. Funding restrictions should mirror restrictions noted in your base S&P funding and come directly from ACL Grants Policy Statement. Please be sure to pay attention to the activities that are not fundable as listed in the NOFO. Those are important to pay attention to. Applicants must document all of their source material. If any text, language, and/or materials are from another source, the applicant must make it clear that the material is being quoted and where the text comes from. The applicant must also cite any sources when they obtain numbers, ideas, or other material that is not their own. If the applicant fails to comply with this requirement, regardless of the severity or frequency of the plagiarism, the reviewers shall reduce their scores accordingly, even to the degree of issuing no points at all. Applications are scored by assigning a maximum of 100 points across 5 criteria shown on your screen. Please note, reviewers are experts in the field, but not necessarily in this program. They don't always have an intimate knowledge of S&P or other OHIC programs. Applications should be written for an audience who does not know the programs. Pay very close attention to the criteria for review and each specific question addressed. We will not go through this section in depth today, but please know that these details are essential to your application's success. As required by 2 CFR Part 200 of the Uniform Guidance, effective January 1st, 2016, ACL is required to review and consider any information about the applicant that is in the Federal Awardee Performance and Integrity Information System, otherwise known as FAPIS, before making an award in excess of the simplified acquisition threshold over the period of performance. An applicant may review and comment on any information about itself that a federal awarding agency has previously entered into FAPIS. ACL will consider any comments by the applicant in addition to other information in FAPIS in making a judgment about the applicant's integrity, business ethics, and record of performance under federal awards when completing the review of risk posed by applicants. An independent review panel of at least 3 individuals will evaluate applications that pass the screening and meet the responsiveness criteria if applicable. These reviewers are experts in the field and are drawn from academic institutions, nonprofit organizations, state and local government, and federal government agencies. Final award decisions will be made by the administrator of ACL. In making these decisions, the administrator will take into consideration recommendations of the review panel, reviews for programmatic and grant management compliance, the reasonableness of the estimated cost to the government considering the available funding and anticipated results, and the likelihood that the proposed project will result in the benefits expected. An award notice will be sent to the successful applicant prior to the project's start date, and the successful applicant will receive an electronic notice of award. Unsuccessful applicants will generally be notified within 30 days of the final funding decision and will receive a disapproval letter via email. Reporting frequency for performance and financial reports, as well as any required form or formatting and the means of submission, will be noted within the terms and conditions on the notice of award. Please be sure to see guidance provided for each of the forms listed on this slide. We won't go into detail on these forms, but I encourage you to find out more information about them prior to needing to complete them and submit them. Agency contacts. I, Marissa Whitehouse, will be your primary contact for this funding opportunity. My title, office, email address, and phone number have been listed here. Tiffany Langevin is the representative from the grants office who will be able to answer questions specifically about grants. I encourage you to primarily reach out to me However, Tiffany has been included here as well. Her office, email address, and phone number have been included here. And last, I will welcome any questions. We do have the informational call recording and FAQ link, which will be uploaded here as soon as they're available. And again, the NOFO contact is me, Marissa Whitehouse, and my email address has been included there. That was lots and lots of information. I'm going to look now in the chat to see if there have been any other questions that have come in. I don't see any. But we've got about a little over 10 minutes. I welcome any questions. How many years is this award? This is a 4-year award, so 48 months, including 4 periods of 12 months. So how many years of narrative and of budget? So the narrative should be for all 4 years, but the budget can be for one singular year. What other questions does anyone have? Can citations be included in a separate page and will it count towards 20 pages? Great question. I believe that the citations do not count towards the 20 pages, but I can confirm that and include it in the FAQ section. If any of my ACL colleagues know the answer to that, feel free to chat it in or unmute. The answer to that is, I believe, in the NOFO. If you'll look back at that section, all the information that you should need should be included there. I'll go back and look for the response as soon as we're off the call today. What other questions do people have? We have plenty of time. Should an out-of-state applicant include the congressional district from the home state of applicant? An out-of-state applicant should provide any information that they think would be helpful to the mission of the funding opportunity and the program. All right, we've got about 10 minutes left. I will stick around for the rest of the time. Feel free to drop off if you're done, and I appreciate your time. If you have any questions before the deadline for the award, please feel free to email me or call me, and I look forward to receiving all of your applications. Thank you for your time today. Have a good one. The question was asked about the congressional district and it being required in the application. How should it be expressed for an out-of-state applicant, including the congressional district number and state? We'll look into that further and provide the response to that on the FAQ that will be posted on the site. All right. Given there are no other questions, I'll go ahead and log off for the day. If you have any more questions, please feel free to give me a call or email me at the email address provided. Thanks so much.